locations within closest EMS and fire units approximately 75 minutes away. They are requesting immediate assistance as you are the closest unit available. Additional information is limited at this time with no point of contact on scene. Police advise they are working on getting communication set up. We'll be flying for the next 4 minutes.
Okay. So mass casualties, so we're going to prepare for triage. We're going to use the mass triage system. We're going to first coordinate with the incident commander to make sure that we're not repeating efforts that have already been done. So we will hopefully talk or touch base with the incident commander right off the bat. It's his scene, and then we'll be the triage and transport officers. So I assume that's how we're folded in this scenario. I'll take triage if you take basic, you're going to be the managed person. We'll set up a triage zone and an initial treatment zone. We'll bring the patients to us. I'll triage them quick. If you call back and let the 75-minute, I assume that's a level 1 trauma center if this is a scene. So we're going to make sure we're coming back to a level 1 trauma center with appropriate care. We're going to make sure that with the PEDS people, if we can triage them to the PEDS ICUs or the PEDS trauma centers, if we can get resources going to the right places right off the bat to avoid confusion later. We will let our dispatch know. We will ask for additional resources if we can. So every ambulance, every helicopter, every first responder, volunteer, whatever we can get, we're going to bring them to the scene. It sounds like it's a large casualty. Something that popped in my head too is make sure that from weapon mass destruction or kind of deep, some kind of large issue that we're going to block ourselves in would be the canary. So we don't want to do that either. So we'll stand back and make sure it's the same first. So from there, everybody has to draw to the So, mass, we'll just start triage. First of all, we'll assess their respiration, we'll assess their cardiac issues, we'll assess their neurological. It's dead, it's extremely advanced walk. So, I'll try to get the walking point to the we will have some area for walking point, so we're not having to walk around our space. But I think on past experience, everybody has to be in the same place. Yeah, making sure everybody else is around. That's good. Get someone left on these that shoot that way. We will take care of people that we can take care of.
What are we taking care of?
Can I have some Advents and first aid? And maybe a sucks, just in case we have to do a crash airgun on somebody. Okay. And you've got what you need? Okay, perfect. So I've got Versed and Ativan in my pocket, just in case we come upon somebody that's seizing somebody that's, not, in pain or whatever. We can actually be, in that situation as well. So do you have any other thoughts right now about what's going on?
Let's just go through them, work through them, set our staging areas. We can treat.
Yeah, I think that's our first priority even. So if you could work on that, and then I've got the radio if you need that. Just let me know if you need to communicate or need to call out more resources. So if you can do a little talking while I start. You follow me and coordinate triage. From there, we'll take care of those who we can. We'll lead those that we can. We'll try to be supportive and make sure the EMTs work as a team with us as well. So calm leadership, that's what our role is just calm leadership. We'll have everybody else help us, and we'll work together as a team. I think we'll be great. Yeah, sounds good, dude. All right, so from there we'll figure it out.
Okay. So we got my accommodate sucks.
Okay. Great. Okay, so we won't have vents. We won't have we'll have extra people, I assume. So we will manage. We will resuscitate.
You would take.
I will take big bag. Will you take small bag? Okay. That sounds great. That sounds great. I'll get this to the triage area. I've got that backup airway in here if we need it. Yep, up top. But I won't be doing any care until I get everybody triaged. I'll be tied. So anything else you can think of, dude?
No. And you got these here.
These define. Oh, my triage tapes. Yep. Great.
Okay, we've landed.
Okay. 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 We take our bags. Okay. Just in case.
Look at everything.
Okay, I'm scanning.
Let's get over to it.
Walking. I'm coming around. The scene's as far as we know. Okay, thank you. Okay, perfect.
Is this Michigan or Cleveland? Because they're the same colors. Yeah, I know. I'd have to look at their tags or badges. Chris, is this Michigan?
Okay. So tell me what time starts.
Good, go.
We're ready? Okay. So we're approaching the scene. We'll leave this right here. Scene
See, they're
safe.
here. They're here. They're gonna help
Okay,
you.
I'm scanning.
Okay?
I see three patients at this point.
Oh my God, you
So
gotta
scene
help her.
safe,
She's
no
having a baby
contamination,
here.
no
I haven't
dump
delivered a
trucks,
baby
nothing
yet.
like that.
Oh, God,
Body
it's
substance
hurting me.
isolation. Number of patients I see
My head hurts.
methods of
Please
injury.
help me.
Okay. I'm going to go triage those right now. If you could start on this one, and this will
Can
be
you
our
help her?
treatment
She's
area.
gonna have a baby here. I
Additional
don't know what to do.
resources.
I'm Jack. I'm the cop. Please help me.
Pilot, please advise me that
Get here.
can you
Get
triage
all
to
these
bring more helicopters to
vaccines.
be
Took forever. Everyone's got ambulance.
Three
I'm the
patients.
only one
I'm
anywhere.
scanning to make sure this is
Oh
safe.
God!
I'm
Please
approaching
help me.
patient.
Nobody else is in here.
I am going
don't
to
know how
turn
do it.
patient into the closest ability
She's gonna have a
to
baby
need to
here. I keep
track.
telling her not to push.
Okay,
This
I am
baby
checking
is
pulse.
coming, please.
Is he does he have respiration at this point? Okay, I'm going to open his airway. We are in a cardiac situation. He's breathing right now. Okay, I'm going to give him a second. No respiratory effort. He's failed. Start triage. He's dead. Can I find through
Susan, how
here?
you feeling? Oh God, it hurts
I'm
so
approaching
bad.
patient. I see a second patient. Do I see any other patients hidden anywhere? Under the dashboard or anything like that? SC? Okay, I'm going to open the airway. Okay, any respiratory effort. Okay, I'm going to give him a second. With pediatric start, I could give him some breath, but he is clearly, he's got gray matter coming out.
Where's my
He is a fatal as well.
Where's
Okay,
my
we're
son?
we're done here.
Susan,
Jack,
how
how can I
far
help
along
you?
are you? Where is everyone, please?
We have the monitors where?
Right there.
Turn that around for me.
Let me take head for a
Just
second.
think it, I have her on
Okay.
oxygen. I have the monitor on right now. She is
Oh,
tachycardic.
please help
Blood
me.
pressure is 80 over 30.
Okay, I'm going to do
That's 82.
Have we done primary surgery?
I have not yet, so what we need to do is get her on her left side.
Okay, let's
So
get her on the left side of the top.
Graham, we're just going to charge you a little bit.
One,
Okay.
two,
Oh, God, don't do that. It's
Are you the first
hurting.
responders or?
I'm a cop.
You're not, okay.
I know, I'm
gonna
sorry.
Hold C-spine in place
It
just for a
hurts.
moment.
Stop it.
I'm going to try to build her C-spine so it stays in line for now. I'm going to do
Oh,
a primary survey. I'm looking,
please
does she
help
have respiratory effort since she's speaking, so she can get respiratory effort. Do I see bilateral chest rise? Okay, I'm going to feel for a pulse. Do I have a radial pulse? Do I have another radial pulse? Do I have any vaginal bleeding to look for a clone for actual bleeding?
This baby
I
is coming. I can
You
feel
saw a
it
head. Okay, great.
bleeding.
We'll work down there
Let's
first.
help me.
Okay, any JVD, any kind of crepitus in her chest? C-spine, we've got, you have a caller we can call for?
No, yeah, everyone's 2 hours away.
Okay.
I have nothing in my car.
All right, so we'll maintain C-collar as best we
My
can.
head is killing me. My
If we don't have a
head
C-collar, I'm
hurts.
just going to make one, and then I'm going to move on to a vaginal assessment. Look real quick. Just a second. All right, I'm going to make a
Where is my
C-collar.
husband?
Primary survey is done. Let's just quick, when you're running the ISTAT, when you're getting that, let's just kind of look. Ma'am, do you know how far along you are?
40 weeks.
40 weeks, so term. Is it only one baby in there?
Yes.
And have you had any abnormal ultrasound, any abnormal findings from the pregnancy?
Everything is fine. What's going on?
Okay, and is this your first baby or do you have other babies?
This is my second.
And was your other one fast or slow as far as you had it? Did you have it vaginally or did you have a C-section?
Natural?
Okay, natural. And did you have any problems with that baby?
No.
How fast did it come out?
I don't know.
Okay, that's great. I'm going to go do a vaginal assessment. My primary assessment's done. She's breathing. She's maintaining her own airway. I'm looking at, we've got a blood pressure 80 over 30 right now. Stats are 82. Okay. We've got non-rebreathing going
My
towards
chest is hurting.
Okay, so I'm going to lower the lungs again. Really quick for that. I have not looked at the very much. I know the belly is
Oh, God, that hurts. Please.
maintained. So, deep breath. Equal.
Oh.
All right, so you're resuscitating. We're going to go to blood quick because what's good for mom is good for baby.
Go ahead, 2 liters. They're going wide open right
Throw
now.
TSA in one of them because I believe she's bleeding just from how abnormally painful her belly is.
Oh, my gosh, that hurts so
I'm going to do a
bad.
vaginal exam quickly. I'm going to see what's going on. Can I approach? Okay, I see crowning. Patient. What's that? TSA gram and the first leader. So run gram plus.
Oh, I need to push.
Start
This
your
baby
blood.
is coming. Please
Okay.
help me.
Perfect. So what's our stat right now?
So we are 82 still.
Okay, so what can we do to maximize
Oh,
that?
God, please.
I think that's...
Do something.
Man, we're short of breath at this point. Let's just do her get it done. The baby is not coming out yet. She's actively in labor. We're going to have to come back and address this. But let's just get her. So I'm confirming my oxygen is at 100%. I got full flow. Okay. And man, let me take some deep breaths and see what that. I don't trust her. I'm not that correct. Just to check our airway one more time. Let's get her to substance process in the center. So I think substance is a good choice. And atominate because Kevin. Actually, let's do Kevin because she's hypotensive. Okay. And then we'll deal with the effects of the baby later. But
This baby is coming. You're going to have to live. This baby, I can feel it.
Okay. I checked it. If it comes out, baby's been coming out spontaneously
Please
for a
help
long
me.
time.
This
We'll let that
hurts so
happen.
bad.
So we've got.
Nasal cannula at 60.
Okay, so high flow. Ma'am, can you take 6 really good deep breaths? Your work is to take a lot of good deep breaths for me right now.
It hurts. My chest is hurting.
I know. But you've got a normal chest exam, so I'm thinking that we're okay for now. I got the. So you're going to have to hold your line for me. I'm going to grab this. Okay. So I'm going to do an airway assessment here. Ma'am, can you open your mouth? She's now potty free. She's got good mouth open. She is going to be difficult because she's got a low functional reserve. So this is going to be a quick and easy tooth and a quick and dirty tooth. If we have to bag, we're going to bag with feet to make sure that we're getting as much oxygen from her as possible. I've got a backup airway as a standard, and I've got a whooshing out just in case.
My head hurts so bad. Please do something. Please do something. Please help me. Where is my husband?
And we're going to put you to sleep. We're going to take good care of you and your baby, okay?
Where is my son? I need to see my son.
Ketamine shots. We literally did time out. We're good. Okay. We maximized. We've got high flow nasal cannula. We've got oxygen going to plasma. We're intubating her because of failure to oxygenate. And we're assuming she has a full belly, especially since she's pregnant. My differentials right now are eruption versus structural peritoneal bleed. I don't feel comfortable on this pelvis right now because of nasal coming out. We'll keep the, that's, okay, she is still looking.
She's still talking. We gave ketamine and stuff.
Man, we're just going to fall asleep.
I feel this baby. I'm ready to push.
Okay.
I need to push.
And so her soft, okay, she's starting to fall down. Okay. She will continue to contract with the sucks on board, which is great. Okay, I'm looking. I've got full view of the cords. You got C-spine kind of. Okay. I see the tube going through the cords. I'm advancing the tube. Hold just a second. Give me a little quickly. There we go. Okay. So I'll go through. Okay. I've got the tube. I've got the C-spine. Inflate my cuff for me as soon as I can. I'm going to bag her a little faster because of the. She's going to be alkalotic baseline with the low tidal lines with the low. Okay. No crackles, no preference right now. Okay. I'm going to set her right at approximately 20 right now. I'm looking at her right now. It's running about 20. She hasn't aspirated. She hasn't had issues this way. I'm looking at her chest rise right now and continue to hold that.
So we're still 82.
Okay. I'm going to just hit
141 pressure, so what?
1. Yeah, I mean 1.
Okay.
Okay. And actually give her a push pressure.
What am I seeing here?
Thank you.
The head.
I'm going to get her on the vent. I'm going to set her. You guys ready for the vent?
Oh my God, my daughter, what's going on? My son-in-law, my grandson, what's
Sir,
going
hi,
on?
my name is Jeff Thomas. I'm going to take a look at her. Is this your daughter?
This is my daughter.
Okay. How old is she?
29.
Okay, and she's pregnant right now?
Yes.
And this is her first baby?
No, second.
Second baby? The other baby was healthy?
Yeah, well,
Okay, I recommend not looking over there, sir. We need somebody to help take care of her. Please, can you talk care of the other and tell her what's going on? Okay, so I'm going to quickly reassess. Okay, we're going to take great care of her, sir. Go ahead and test for a second, please. I'm going to reassess one more time. We're going to put her on the vent. We're going to set the FO2 at 100%. We're going to set her rate at high rate. Her feel is at 80, so I'm going to set her at 480. Rate of 20, so a higher ventilation than the acidosis. FO2 at 100%. Keep the 0 right now.
Oh my God, the baby's coming out. Baby's coming out.
Is she on the vent right now?
They're doing pretty well.
She's on the vent. I'm looking for chest rides.
he's not my grandson.
We are going to help you, sir.
Last team.
Necessitating ladies successful.
They're going to help her. They're going to help her.
Doing any of this. Did she? Why did you? Fluid oxygen sensitive.
Yeah, I'm getting set up for resuscitation. Did you get that push dose pressure test?
I did not.
Okay, I'm going to give her a push dose pressure right now. Can we cycle another blood pressure? Cycle every 3 minutes.
Push those pressures, baby.
I'm going to give her
both shoulders, so we're not, but I don't want to put any
He just cardiac epi.
push dose pressure on 0.3. I'm going to be ready in 2 seconds. Push dose pressure in.
I give him 0.3 minutes.
Flow is going wide. Okay, I've got an airway set up. This is going to be my working zone, so I can watch the mom. Blood pressure 70 over 30 on the mom, so that's
He
your
clearly didn't
resuscitation
get
priority.
coming out.
Okay, let's start.
There, I want to go ahead and
Okay, hold it at the level that
There's
we
big
planned
right
before.
here.
Okay.
Okay, yep, so
All
I'm
right,
looking at
I'm going to bring the baby in. Is she tethered here? Okay, I'm going to bring my pile of work over here.
and cut in between.
Like that.
No.
Okay. I'm going to resuscitate the baby in place of them because she's tethered.
70 over 30, can I get another?
I'm going to set the baby right now to make it have me tone. So I'm going to warm, dry, stimulate, suction.
Why isn't he crying?
Okay, I'm going to warm, dry, stimulate, suction. Anything right now? Okay, I'm going to test what is my core. None. Okay. I'm going to assist ventilation. I'm going to give it 30 seconds of assisted ventilation for energy. I'm going to warm her in place.
I think the mom's on the
I'm going to cover up the hip in place.
I want to look,
I'm going to look for any injuries secondary to the trauma. Does she have any injuries right now? Okay, I see no injuries from the trauma. I'm ventilating to create chest rise. I'm confirming 100% FiO2. I'm bagging the single 5 to help push the amniotic fluid back in and a positive pressure. So one every about 12, one about every 8 seconds.
sets are not there. What I'm thinking right now, Jeff, how are you doing over there?
I'm doing fine. Okay.
So
Take
over
your
here,
pulse after 30 seconds.
60 over 30.
Okay, heart rate's 30.
Still, where
I'm going to start CPR.
Yeah, they got him wearing GoPros.
Where it's going to go.
1, 2, 3, 4, 5.
This is got one minute. I was trying to supposed to get some hot load during the daytime. Have that scene, and we're going to make a Z video. But he's such a white clown that he literally hasn't been 4 months, has not been able to physically get hot load on the same flight
I see no signs of
during the
bleeding,
daytime.
no kind of, I've got suction where I can get to it if I need to.
Jeff, did you already get push those pressure 5?
Yes, I gave push this pressure right before I walk away.
And we didn't see a response to that. So I'm going to go ahead and give 50 of Benadryl.
1,
May not carry blood, I
4,
guess.
5. How about that? Do I have anything? The heart rate's on the way up. I'm going to start to step.
Who is this? Who's this?
We're going the right direction, but check your
University of
dial.
Michigan survival flight. Oh yeah.
1, 2,
They have to carry blood.
five.
You would think so.
Thanks, man.
What's that? You would think so.
4, 5. Okay, heart rate is going up. It's going to take 1 minute to start IV access.
Do I have a pulse?
They almost never do scenes.
No.
I'm going to identify the site. I'm going to clean the site.
I'm going to go ahead and give another push dose pressure. It's 1/10 of the code dose. Okay, Jeff,
I'm going to line up. I'm going to that's going to go. I'm going to place it in there.
Yes,
I'm
go
going
ahead
to. All right. Well, we're doing a little better here. Okay, I'm securing my start. I'm going to go back.
We've never had a team compete.
1, 2, 3, 4, 5. What about a public
Todd
fire?
Davis and Susan Cozy in
1, 2, 3, 4, 5.
So if there's any questions,
1, 2,
9.
3, 4, 5. Hey, you see your blood?
No.
Give me your project.
Davis and Cozy in 10. Examine and Gunderman in 11. And then in 12, they got so many people applying to they had to start running a lottery to get in.
Equal
And the only way you
5
could guarantee to get in was to be one of the top 3 teams from the year before, which, in my opinion, we were, but in the judges' we were not. And we've lost in the lottery every year since.
is there anybody here in the top? Can you help me?
Eventually, we'll get back in.
We don't have blood pressure and heart rate. 1 breath every 6 seconds. Great.
Hey, Chad, do you want to deal with this case?
Did you hear?
She said diminish before.
She said where?
Bilateral.
Bilateral. Yeah.
2, 3, 4, 5. Second for a pulse.
Help them.
110. Okay, I'm going to slowly, I'm going to continue breathing. I'm going to draw. I'm going to invariably give her.
Okay, so we're going to go
I'm
ahead
going to ventilate every 8 seconds. I'm going to warm still. My priority is going to warm. Okay, sir, you're doing your grandson's got a pulse back. That's a good thing. I'm going to do a primary exam right here. I'm going to look to make sure I'm looking at pupils. Okay. Do a trauma.
Okay, I'm going to check a breaker pulse. Do I have a breaker pulse? Okay, so I have I'm going to recheck my pulse here, and I'm going to give him a breath every about 6 seconds.
So if you can figure out what all that has got in its walk list. You know, really very similar to that. SWAT.
Be right back. So after 30 seconds, how is he doing now? I'm going to check the pulse. So it's still no pulse with that? Heart rate's 110. I'm going to give him blow by oxygen for now. I'm going to go get some equipment, and I'll be right back. Okay. So I'm going to go ahead. I'm going to steal your pulse ox. That's fine. So I'm going to go ahead and give a milligram of I'm stealing the pulse ox from the patient, placing on the right arm of this patient to watch your heart rate. I'm going to get...
Done that. Acidosis, I think, with the bilateral chest tube. So I ended up legally both sides when I get much there.
You did or did not?
I did.
Okay. So I'm going to attempt to warm. I'm going to give him some glucose, just empirically, because this is a critical situation. I'm going to give him, he is going to convulsions to D25 just to get him over. I'm going to give him D25 convulsions. I'm continuing to warm. I'm reassessing right now. Is he crying yet? Okay. Is he still got a pulse? Okay. He is protecting his airway. Check. I'm looking right now to see the leg get all. Okay. So I'm going to give. So about every 8 seconds.
Calcium.
Hey Chad, you might have to call back, or I need your help here. Yeah, no, I need your help. So if you've been doing that a while, you might have to walk away from her.
So I bilateral, just walk it through with me, just so we know. So I bilateral, both sides of the chest. I got to work the air, but I have enough for the monitor. I gave a round of MDs, calcium, bicarb.
Okay, you're done. Thoughts?
Okay.
So what is our stat right now? Turn that monitor to me.
Stat-wise.
I changed the stat from her to him.
Yep. What do we got?
Okay, I'm going to make sure my FO2 is still 100%.
All right.
Where are you going?
So here's the I understand, sir. There's nothing more we can do for her right now.
He's got chest rise and a good pulse. Okay, I need you to give blood for him here. Actually, give him steel and saline. And then he's got good pulse, no respiration. I wasn't placed back barely. He's got, I just gave him D5, because that's what I thought. I was getting happy. We've got decent pulses, no respiration. So we need to intubate failure to protect airway. So let's just give him, I'm going to check it. Do I have a breakup pulse still? Okay. And the rate is about, okay. So FO2 is 100%. My monitor is, my stats are currently 8 so we're on our way up. We're getting bigger tidal bodies to get a little bit more excursion. So let's give him, he's crashed really. So just give him, he's rebrothing. Let's give him 4 kilos of rebrothing. Yeah. So let's give him 8 of sucks.
I think she moved.
And a crash goes.
I think she moved.
And let's have puncture suction at the bedside. I need a OG tube in as soon as we can. I haven't taken the bag in a while. And then we'll fluid resuscitate the goals. So soothing. Okay. And my airway assessment is as is. Can you set up my... Yep. I'm going to continue the bag. We're going to continue to monitor. We've got a heart rate up on the pulse ox. We've got pulse ox going to heart rate. Heart rate, our stats now are 85, okay? And that's on our right upper extremity.
It's not so bad.
So,
I think she moved.
okay. I'm watching for gesticulation. I don't have it. Okay, we've got the bag ready.
It's kind of normal.
Sweep this tongue. I'm going to look in the mouth. I see full view of the cords. I see the tube passing through the cords. There's no resistance. I'm holding the tube in place. 4 times 6 plus weight kilos is 10, so I'll have my depth at 10. Hold a second. Tube is at 10. I'm going to manage that and tell you. Yeah, there you go. Listen for it. Pilot said what?
So end-tidal CO2, do we have bilateral?
Enter, go ahead.
We got a previous they're telling us about 3 or 4 more minutes. We got a list of instructions like this. So,
let's see if I just give you the trauma too. So we're going to take it to the closest level 1 nursery. Actually, level 3 to 3. The trauma center. We'll go to the trauma ICU. We're going to take the best care of what we can. And we're going to get some labs on the way. We're going to continue assessing. We're going to keep them warm. And we're going to keep them safe to the best safe we can. Sorry for the rest of the family, but we're going to go. Okay, so yes. So we're going to do our best. Let's confirming outside of okay, so I'm slowing down my respirations. And I'm holding my feet up to the flies.
I bet you the mom died of
so I don't know
uterine rupture, hemorrhage.
We're actually at a decent stat for his age. So I'm fine with 100% oxygen going through him right now. Because he's in shock, I'm going to do 100% oxygen. I'm going to keep his end pedal about 30, so I'm slowing down my respiration to about 12 a minute. And I'm going to handbag him.
You can do for that in the field.
So if we can
Blood
board him, get
products
him
and
back out of
blood.
here, so we can helicopter. Okay,
We had one in 08 where a guy named Kurt Smith, who's faculty here at Vanderbilt now, was the doc, and he figured it out because he could palpate fetal parts on the abdominal exam. And is that the perineum C-section? No. No, they just resuscitated with blood. And yeah, and the baby did not survive, but the mom did.
I'm holding. Sir, I'm so sorry.
That was the
Okay, we're going to get full portable. I got a body management.
They've all been before my time.
Keep him midline.
Wake up, come on, wake up. Wake up.
Keep him midline. I'm going to slow down my end tidal. My end tidal flow probably from low perfusion state. So let's just consider giving him blood as soon as we can too. Okay. We've given him 10 per kilo of fluid, right?
I have not yet.
Okay. So fluid resuscitation is our first goal, and overall resuscitation is the second. Can I hop in and watch the airway as we? Okay. So right now we've got a kid that's been in trauma.
Okay.
We've got a kid that's. Okay, I'm bagging slower, but I think we're low perfusion. So can you? Okay, tell me how I can protect the tube.
Okay, I'm going to go around the other
All
side.
right, please do. Pull up that fluid, will you?
Yep.
Okay, bagging every 6 to 8 seconds. Confirming my FiO2 stays 100% in the move. Watch that airway check. Okay, I'm going to get out of your way and go over to the other side. You guys are good loading. Sorry. Chad, why don't you reassess long sounds just to make sure after the movement? Okay.
Slide it down this way.
Okay, I'm going to draw up.
You need a bag?
Yeah. You got your fluids?
I'll do the fluids.
Okay, so he's 4 kilos. So let's give him 40 of packed cells right now.
Okay.
And I'm bagging, I'm checking. His cap refill now is very low. His blood pressure, have we cycled that yet? Okay, at 40? His math is 40? Okay. Okay, oh, his math is high.
So 40 cc's of packed cells, you said?
Let's do that because of poor perfusion state. We've already, actually hold the packed cells. Let's give 10 per kilo of saline first because he's in a decent perfusion state. I assume that he's in low flow, and I assume that he's hypoxic from, so if you can get a blood gas on the way, and a glucose to recheck.
40?
40 of fluid.
Okay, so plunge that in.
Plunge that in as soon as we can because he's low perfusion.
Go ahead with NIO.
Can I put him on the bed? Okay, so he is a pediatric patient, 4 kilos, so I'm going to put him in pressure. I've noticed that his PIP pressures are running about 20, so I'm going to set the vent at 20 over 0 because he, well, actually 20 over 4 because he's hypoxic at this point. I'm going to set his rate about 26. I'm going to watch the end-tidal CO2. I'm going to set my PIP alarm about 5 above what my PIP pressure is, and I'm going to set my disconnect alarm. We're on the vent.
Do I have it?
Okay.
Okay, secure the sharp.
I'm going to draw the ISTAT out of the. I'm drawing your ISTAT. I'm also drawing cultures right now just because. So ISTAT.
And vital.
Okay. Okay. So we're going the right direction, Chad. Okay, ISTAT's running right now. Okay, so we will run the ISTAT. So let's stop and redress.
Okay.
Are we in flight? Have we launched? Okay, so University come online for 155 you This is pediatric level 1 trauma alert. We've got a brand new 40-week, 4-kilo male. He was involved internally in the mom in a high-speed WC with 3K on scene. He is unresponsive at this point with the delayed cap refill, but decent pressure. He's in a low flow state, shock state. We assume by hypovolemia at this point. He's intubated, ventilated, 2 IOs. His belly is somewhat firm, so I can throw that in one. And his secondary assessment I will complete before we get there. You can have the level 1 trauma team available, and we're fluid resuscitating the goals at this point. Okay, OG tube to decompress and marking. Marcus. And pilot, can you turn the heat up as hot as you can get it in this machine?
Yep.
And I've got warm packs right here. I'm going to warm pack the kid. Okay, warm pack on each side. And then heat in the aircraft as high as I can. I'm going to
You have the OG tube in place?
OG tube, so I'm going to repeat a secondary survey.
Okay.
So I'm looking for any crepitus, any step-offs, any belly. I'm going to look for it. I want the excess. Perfusion pressure, he's got pulses in both
We have
braces.
the
Okay.
think
And legs,
either one of them
feet-wise,
is
he has
belted.
pulses.
Okay.
And he's got violent chest, right?
Seatbelted.
I'm going to look at his eyes again, just to see if he had head trauma from the injury.
Any hemorrhage?
Pupils are
Any blood?
equal. Fontanelle is soft. Fontanelle is soft. Okay, so this is medical until proven otherwise. So we've warmed, we've dried, we stimulate, we suction, we check the glucose, and we'll recheck the glucose. We will do warming measures. We will consider what could be unresponsive shock. He could be septic from the mom. He could be hypovolemic. Okay. So okay, so in most cases of neonate, we could, so he's metabolic acidosis. Yes, more fluids, and glucose was. Okay, so we're good on the glucose, and hemoglobin didn't come back. Okay, so we've got a metabolic acidosis, low flow shock state. I'm sure he's lactic acidosis. Fluid. We could give bicarb, but the research says the bicarb in neonates is a very bad idea and outcome. So we're going to hold the bicarb. 210 per kilo. We're going to let the fluid do the work. Let's let just vitals are. Let's repeat. So unresponsive kids, glucose, meningitis, cardiac. He may have some neurogenic process going on that we didn't know about. Head injury. Metabolic is really low state at this time. He's otherwise a normal baby that was otherwise healthy until the baby came out. We've called report. We've done secondary assessment. We're watching chest.